everyone stand up. 1, 2, 3. Please stand. Okay. 1, 2, 3. Please sit. Now I'm going to start, so time hasn't started yet. Hello, my name is Tisha Jepson. Good morning. Welcome, and thank you to Tishman, thank you to Tien. Thank you for making this all possible for us. I am here to talk to you about infection diagnostics to be specific. Doctors currently don't have available to them in their toolbox an ability to determine if an infection is present or not at greater than 50% accuracy rate. This is talking about before CT scans, before exploratory surgery. We all may know someone who is experiencing chronic abdominal pain. And this person is on, or these people that we might know, are experiencing months, years, and sometimes a lifetime of trying to recover from the experience and are unsuccessful. TrueBearing Diagnostics has an RNA-based blood test that is 97% accurate, that can assist doctors with being more accurate and more effective with finding solutions for those patients. So the problem is, how can infection be distinguished from sterile inflammation, embolism, trauma, allergy, toxic exposure, torsion? The TrueBearing solution, TrueNav, allows for leukocyte reaction to infection, increasing certain RNAs in specific patterns to be seen. We're measuring these RNA levels, which allows for pathogen detection by the host response. So we're not tracking or tracing the disease, we're looking at the human. This allows us to be agnostic. So we're looking at bacterial, viral, and biofilm infections. TrueBearing takes a different tack. Essentially, DNA is stable throughout one's life. RNA is an ever-evolving, ever-changing picture and is allowing us to see what's happening today. It's like a circuit breaker box, what's on and what's off at any given time. With TrueNav, TrueBearing is detecting and measuring neutrophil activation. This is essentially the human immune response. It's a type of white blood cell. So it's not the number of neutrophil cells that we're looking at, it's the activation. TrueBearing Diagnostic, the TrueNav diagnostic, is looking at 6 RNA biomarkers. We are delivering the answer through droplet digital PCR, that's ddPCR, on the Bio-Rad system, which is 510K FDA cleared. We are published, we're patented, and we're seeking funding for FDA clearance trial and commercialization. Okay, it's not going. The annual market size for infection is about $10 billion. Abdominal pain accounts for 16 million cases a year alone. TrueNav and TrueBearing have completed 3 studies in which were published, and the first being for appendicitis, the second abdominal infection, and the third for COVID. We're currently also underway with forgot the word for it. There we go, sepsis, sorry. So, our pipeline of applications: chronic abdominal pain, appendicitis, novel pathogens, sepsis, chronic sinus pain, implant biofilms, iatrogenic infection, pneumonia, wound infection, and antibiotic effectiveness. Antibiotic effectiveness is important because not only are we able to determine and to measure the binary decision, is there an infection present or not, but also its magnitude, so we can track the progress of the solution that is undertaken in any course of action. Currently, we are raising $40 million to complete our FDA clearance and commercialization launch. We already have $12 million into the story. That has allowed us to complete clinical studies, 500 patients, actually in excess of that. Proprietary biomarkers are identified, licensing agreements in place, patents achieved, multiple data sets, publications. The $40 million we will spend with recruiting key opinion leaders, completing 3 hospital group FDA clearance, establishing a CLIA lab, commercializing in the CLIA LDT setting, that's before FDA clearance, and then commercializing post-FDA clearance and with a launch phase 1 sales and marketing program. I've been told I can go an extra half a minute. Please, if you're interested in being involved in TrueBearing in this huge global opportunity, ask about our convertible note opportunities so that you might participate. Our key management team includes myself and Tim McCaffrey. He started genomics at Cornell, moved on to GW to start the genomics division here, and diagnostics is his life's work. We also have a scientific advisory board of Chad Hoyt at UVA, Dr. Chwala at GW, and Chief Medical Officer of Silver Creek Pharmaceuticals, and John Burzak, formerly Global Head of R&D at GE Healthcare. Thank you so much for your time. I look forward to answering any questions.